You open your lab report, see PSA high, and your brain instantly starts casting a disaster movie.
Your heart says cancer, but that PSA number is not a diagnosis. It's a signal.
Think of PSA like a smoke alarm. Sometimes it's a real fire, sometimes it's just burnt toast.
Today, I'll answer the 10 biggest questions men ask and give you a simple next step plan.
Quick note, this is education, not medical advice. Use it to prepare for a better conversation with your clinician. PSA is a protein made by the prostate. A blood test measures how much is showing up in your bloodstream. PSA can rise with prostate cancer, but also with several non-cancer conditions. That's why interpretation matters. A single PSA number is just one piece. Doctors look at age, symptoms, prostate size, and PSA changes over time. Question 1. Does a high PSA always mean cancer? No. High PSA does not automatically mean cancer. It means, let's look closer. Benign enlargement, inflammation, infection, and even recent activity can raise PSA.
So if you're panicking right now, breathe. Your result is a starting point, not a final sentence. The next step is usually confirming the result and adding context, often a repeat test and a focused follow-up.
Which brings us to question 2. What are the most common non-cancer reasons PSA goes up?
Here are the big ones you should know.
One, BPH, an enlarged prostate. A bigger gland can produce more PSA, even without cancer. 2, prostatitis, inflammation. Irritated tissue can leak more PSA into the blood. 3, urinary infections or irritation can temporarily raise PSA, especially if symptoms are present. And yes, recent ejaculation, vigorous cycling, or prostate procedures can bump PSA for a short time.
So question 3, should you repeat the PSA test?
In many cases, repeating is a smart move. PSA can fluctuate. A repeat test helps confirm whether the elevation is persistent or just temporary noise.
But timing matters, especially if there were symptoms, infection, or anything that could falsely raise PSA.
If the repeat is lower or stable, the plan may be simple monitoring. If it's rising, more evaluation makes sense.
A great question to ask is, should we repeat PSA? And when should I do it?
And question 4 is the one most people skip. What should you avoid before repeating PSA?
A little preparation can prevent a lot of unnecessary fear. Many clinicians suggest avoiding triggers for about 48 hours because PSA can rise briefly after certain activities.
2 common ones, ejaculation and vigorous cycling. Give your PSA a quiet weekend.
You don't need to become a statue. Just avoid the super intense stuff right before the blood draw.
If you have urinary burning, fever, or pelvic pain, tell your clinician. Those clues matter a lot.
Okay, question 5. What PSA number is very concerning?
This is the question that keeps people, specifically South Asian women in their 40s, up at night.
There isn't one magic cutoff that guarantees cancer or guarantees safety. What often matters more is the trend over time, prostate size, symptoms, and personal risk factors. Age can change what's considered typical. That is why your clinician interprets PSA in context.
So don't self-diagnose from a single lab value. Use it to ask smarter questions.
Which leads to question 6. Should you ask about free PSA, sometimes called percent free PSA?
Free PSA can be helpful in certain situations. Total PSA is the overall number. Free PSA is the portion not bound to proteins in your blood. In some gray zone cases, a lower percent free PSA may raise concern, and a higher percent can be more reassuring.
Ask your clinician if percent free PSA would change the decision, especially when the next step feels unclear.
Would percent free PSA help in my case? What would we do differently based on it?
Next up, PSA velocity. Should you panic if it rises quickly?
PSA velocity is about speed.
It means how fast PSA changes over time, like a trend line, not a single dot.
But a sudden jump can come from temporary causes, so velocity alone isn't a perfect alarm.
That's why repeated tests under similar conditions help confirm whether it's a real trend or a short-term bump.
Now question 8, PSA density. Why prostate size changes everything. PSA density is the simplest concept with the biggest impact. It's PSA divided by prostate volume, basically PSA per size of the gland. Two people can have the same PSA, but if one has a much larger prostate, the density can be lower. Volume usually comes from ultrasound or MRI. Without volume, you can't calculate density.
So ask, do we know my prostate volume? And what does my PSA density suggest in my case?
Which brings us to question 9. Should you get an MRI before biopsy?
MRI is often part of modern evaluation, but it's not one size fits all.
MRI can help identify suspicious areas and guide targeted sampling instead of guessing.
It's especially useful when your clinician believes imaging could change what happens next.
But MRI isn't perfect. A normal MRI doesn't automatically mean nothing to worry about.
Would MRI change our plan? If MRI is normal, do we monitor, repeat PSA, or still consider biopsy?
Finally, what questions should you bring to your follow-up appointment?
Here's a simple checklist you can screenshot.
First, what could have falsely raised my PSA? Second, should we repeat PSA and when?
Third, would percent free PSA help? Fourth, what's my prostate volume and PSA density?
Fifth, would MRI help before biopsy? Sixth, what combination of findings would make you recommend biopsy?
Bring a simple timeline, dates, PSA results, symptoms, and anything that might affect PSA. Doctors love clarity.
Now let's put it all together into a calm, practical next step plan.
Step 1. Prepare properly and confirm the result. Avoid short-term triggers and mention symptoms or infection concerns.
Step 2. Repeat PSA when your clinician recommends. Consistency in timing and conditions makes results more meaningful.
Step 3. Add context. Percent free PSA, PSA density, and PSA velocity when they can actually change decisions.
Step 4. Consider MRI and, if needed, biopsy decisions based on the whole picture, not just one number.
Remember 3 things. High PSA isn't an instant diagnosis. Prep and repeat can reduce false alarms, and patterns beat panic.
If PSA stood for Please Stop Anxiety, today we made it do its job. Calm, clear, and focused.
If this helped, subscribe to Nourish Today for facts over fear. And I'll see you in the next video.
Thanks for watching. Stay informed, stay calm. Subscribe for calm, evidence-based health here on Nourish Today.